Stop that. Now I want to pause it. Oh, okay, so this will be recorded. If anybody has any objections, just go hide. Uh, we expect that we will have time for questions and answers after Susan gives her presentation. So on behalf of our little group, which is called Associate Patient Advocates, welcome all to our monthly series. Susan is a licensed clinical social worker. She does counseling. She's worked for many years with people of all ages, down to adolescents and kiddies and up to oldsters, and people with various medical problems. And she does a lot of clinical work. And she is the touchy-feely person in our group. We started this because after I semi-retired from practice, we discovered that people really needed help navigating the medical system, which I had helped friends and relatives do. And so we decided we should do this for the public, which is what we do. So we have a team of 6 people, and we share the work and the glory. So this is one in a monthly series. Susan has given the last couple of talks. Before that, Dr. Rohr and his group were kind enough to talk about the second opinion work that he is doing with a pro bono group in San Francisco for oncology patients, those with cancer. We have had talks from a variety of people, including talks about the US healthcare system and how it works or occasionally does not work. Next month, we've arranged for one of our advocacy colleagues, Donna Smith, who has her own company in Sacramento, which is called Healthcare Choices. She is probably the guru of dealing with health insurance companies, having been on the battle lines with them for about 30 years. And she will talk about the No Surprises Act, which amazingly got through Congress. Congress actually did pass something last year, and it is now the law of the land. And she'll also give a little bit of a health insurance update for 2022. However, tonight we're going to listen to the one, the only, the inimitable Susan Bucker, who is going to talk about starting the new year off, looking at it for a way to walk on the sunny side of the street, a new year, new opportunities, and also related to the work that she does with us, being an advocate for patients. So Susan, you're on.
Thanks, Harley. That was a great introduction. So my last talk was on the coming of the holiday season and what that entails. And tonight we're going to talk about the post-holiday season. So for some, the completion of the holiday season is a relief. Many people feel that way. It is physically, financially, and emotionally very challenging. And very apropos for an advocate to help out with these different feelings, as you'll learn tonight. So now what? Now that the holidays are over, now what? How is it that people feel? So we're going to start with post-holiday blues. And this post-holiday blues shares many of the same symptoms as depression, actually, including fatigue, feelings of sadness and loneliness, low mood, and difficulty concentrating. Post-holiday, however, unlike clinical depression, is shorter term for most cases, in most cases. We can't really generalize, but just overall. So what causes this? The adrenaline come down after the holidays actually causes sadness. Some people have come to me and say, and some of them are undergoing treatment for different illnesses, one of them being cancer, which I do a lot of work in. And they don't understand why they're feeling so sad. And they think it's maybe the chemotherapy and it's maybe the radiation, and they're not really sure exactly what it is. But the point is, it is an adrenaline come down. So that does make sense. That is a sudden withdrawal of stress, which can have a significant impact on our mental health. There's a term called the contrast effect. Contrast effect. It is the brain's way of trying to restore some order. It is a sudden departure from one's regular routine. And we're going to get into that a lot, but I want you to keep in mind the importance of a routine in our lives. A routine makes everything smoother. And just to share this a little bit, since I have Dr. Aurora with us, who is very dear to me, he knows when we worked at Epic that a routine is very, very important. A patient comes in, and not only the patient, but the treating person has to have a routine. They can't be all over the map. They have to know, okay, I'm going to see so-and-so for so long. I have so many people coming. I need to do a comprehensive check with the nurses, with another doctor, with a nutritionist, with a therapist, whatever. Everything is a plan and a routine, and that's very important. Okay. So some coping mechanisms include getting a good night's sleep, very important, eating a balanced diet, practicing mindfulness and meditation techniques. Many, many, many people whom I see do not stay in the moment. What if this happens? What if that happens? Oh my God, this year is going to be worse than last year. And they go on and on and on in many, many ways, including politically, which we won't get into, including the coronavirus, all of that. It's very important to stay in the moment. Stepping stones may help. Instead of trying to get to where you want to be in one fell swoop, it's very important to do it in the form of steps. Very important. I call those stepping stones. Extra self-care, time just for you. And that means real quality time spent with your thoughts, with your emotions, with what you want to do. And we're going to get into that a little bit later when we talked about cognitive behavioral therapy, because that will help a lot too. And that's all about thoughts and emotions. So carve out that time for you. Just carve it out, you put it on your schedule, and you don't have that opening. You don't have an opening in your schedule because that's your time. Okay. It's just like taking a lunch break. Some people never take a break and they pride themselves on that. That's not really that smart. Everyone needs a break. So you need to take that. You need to eat properly and have good nutrition. Surround yourself with loved ones. Reach out to help others. That's a great big mood enhancer. Learn how to navigate for your best results, and use therapy and advocacy, coaching. Use all of these resources. They're available to you. Don't decide you have to do it all yourself. I had the pleasure the other day of doing some work with an attorney, and the attorney is extremely busy with a wait list for, I don't know, till like a 5-month waiting list for an initial appointment. And I was so proud of this man because he's taking the time away from his practice to talk with me every single week for an hour. And it helps him organize. It helps him calm down. It helps him try to figure out what time is for work and what time is for family and what time is for himself. It's a very, very, I'm not going to say, it's great because I'm the therapist. I'm saying he says this is great. He's really proud of himself. So I'm leaving it at that. Techniques for successful coping takes great determination, persistence, and advocacy. One needs to decrease their anxiety. And the only way one can decrease their anxiety is to manage it. Deep breathing can help. Focus, very, very important. You might be saying, well, I am focused. We're not always focused all the time. It's very, very important. Limiting alcohol and caffeine to a degree, both are fine, just within reason. Taking time for yourself, as I said before, and facing your fear. That's something many people don't talk about. Everyone has fears, and everyone has, we talk about the fear of success as well as the fear of failure. I see people for the fear of success. They don't know what they would do if they were really successful. They're worried about it. And so it's not just fear of failure. And delineate your concerns. Learn your triggers is very important. Now, a lot of times you can't learn your triggers without some help. And on another level, I have my own organization called Change, which stands for, and it's right about triggers. Come help another, notice greatness emerge, change. And that means to me that we're not in this world alone, which is also analogous to the word advocacy. If we're not in this world alone, we're in this world and we need help in certain things. And when someone comes to see a physician or comes to see in a mechanic, whoever they come to see, they need help. And one has to recognize that it's very good to reach out. It's not a weakness. Many people look at it as a weakness. Contrary, it's a strength. It's not a weakness at all. So that's good to remember. Also, question your thought patterns. And we'll get into that with cognitive behavioral therapy. Aromatherapy helps many people. Lavender, chamomile. It is thought that aromatherapy may actually help activate certain receptors in your brain, potentially easing some anxiety. So it's not just a fancy foo-foo thing. It really has some effect. And also keeping a journal can help people with their stress. So some general triggers that fall this time of year is stressful work, traveling, which is extremely, controversial given everything going on in the world. Genetics, anxiety can run in your family. Withdrawal from drugs or certain medications, all the doctors know that for sure. Trauma. Now, post-holiday, trauma can happen at any point. Many people have some traumatic events during the holiday. Someone just spoke with me today about post-traumatic stress disorder. A loved one had surgery and the loved one survived the surgery, but the surgery did not go well. It was very, very chaotic. The hospital, according to them, I was not there secondhand, but the hospital staff was very chaotic. It was once they got going, there was a 3-hour wait somewhere. And it almost sounded like they were in an emergency room, but they were not. And the person having the surgery and the family were extremely upset and absolutely needed an advocate. They needed someone to talk it through. There was nothing that they could do. They didn't know how to get through to these people. So that's very important as well. Chronic illness, we all know, such as heart disease, diabetes, asthma, cancer, phobias such as agoraphobia or claustrophobia, just name a few. Chronic pain. Many people let things go during the holidays. So that's worth bringing up. We're so busy with what we have to do and eat and buy and be. And I know this year has been different than many other years, but still causes a lot of anxiety and can cause a lot of depression. And the reason why trauma comes up this time of the year as well is that we're with loved ones. Some of them are not so loved. Some of them have been kind of problematic in one's life going way back. You all know those stories. I have worked in the past few years with a young girl who was quite abused as a child. And when the abuser, whom the rest of the family doesn't know was an abuser because she was shamed and didn't want to tell anybody about it, was at the actual dinner table on Christmas Eve. And that was a tremendous, I'm going to be very busy trying to help her because she's reaching out to me again. Not to mention that there are families that following the holiday, a whole family, pretty much 9 out of 12 people at a dinner came down with COVID. So that was not pleasant. Everyone survived it. 2 people were in the ICU, which was very unpleasant, but at least everyone survived it. Cognitive behavioral therapy can be used for holiday stress, and that can be used with advocacy. And what that is, for those of you that aren't familiar, is you take a situation whatever that situation may be. So let's say somebody is very sad that they've lost a loved one the year before. That's their situation. And then you find out what are their thoughts about that situation. So their thoughts may be that wasn't fair, quote unquote, and the person shouldn't, this should not have happened, and the person didn't get the right care, and et cetera, et cetera, et cetera. Then you look at your emotions. How do you feel? Maybe you feel frustrated, you feel angry, you feel anxious, you feel depressed, whatever it is that you feel. And then you spin that to the behavior. How are you going to deal with it? So of course, the best way to deal with it is ideally, and it may take quite a while for us to get there, but ideally the idea is we can't do anything about what happened, perhaps. We try to understand it, try to understand what it evokes within us, and figure out how we're going to move forward, bringing that person with us, bringing their honor with us. And it sounds like, it may sound to some of you that this is easy to do, but believe me, cognitive behavioral therapy is very hard. Sometimes when I work with a paper, or when I work with a, what do we call that board? Like a big board on a big poster board, like I used to do at Epic all the time with the patients. And we try to spin the situation, and we have to tear up, I don't know, 10, 15, 20 sheets of paper with everyone in the room helping us, helping with a situation, because the behavior is no good. You know, we had one behavior where somebody wanted to do self-harm. The person felt, the family felt like, well, I'm going to hurt myself now that this person is no longer with us. And obviously that's not a good way to spin the situation. So we threw out that piece of paper and we came up with something else. And it took quite a long time to come up with a solution that seemed like a viable one. So I bring that up, it's very important. Now, on advocacy post-holiday, what an advocate will do and why it's so important is an advocate can listen to your views, help you explore, note the word explore, your options and rights, okay? Empower you, provide information to help you make informed decisions. Remember that when someone, which I don't have to tell the group listening tonight, that when someone is in trouble and gets bad news, it's very difficult to make an informed decision. It's very difficult to feel any sense of empowerment. That's got to come from somebody else. That's where an advocate comes in. Help you contact relevant people or contact them on your behalf. Sometimes you just can't do it. And capable, we all like to feel how capable we are and we handle everything, but sometimes it's too much to handle. And somebody else, believe it or not, can handle certain things better than we can. Many, many times. And it's remember, it's a sense of strength to bring in some help. It's not a sense of weakness, it's a sense of strength. Patient advocate can support an individual and family to promote their well-being. Many people have a really hard time after the holidays feeling well. They're so darn tired, and they're financially, some of them are broke. Some of them are homeless. We work with a lot of people who are homeless. It's hard to imagine. Take a young woman, has 4 small children, and she's living in a park. And we're trying to gather clothes for the children. Children are freezing. You know, they have a few clothes, but they don't have warm jackets. What are they going to do with fancy little outfits for the holiday? They need warmth, you know? So someone has to step in. And this is where advocacy comes in. And an advocate is trained and educated on how to do that. Now, on a different note, post-holiday, we want to look at I think I'm going to jump over to this because I think you people know this part. So I'm going to jump over to the letdown feeling and what we can expect, and a good way to look at the new year. And a good way to look at the new year is as a fresh start. Many people tell me, I like to add vignettes, and so it's very real what I'm saying. Many people tell me this is no fresh start. 2021 was a horrible year for them for whatever reason, whatever they went through. And I don't believe 2022 is going to be any better. All right, they're entitled. I have to validate. If somebody tells me something like that, I'm not going to argue with them. However, it's definitely not going to be better if they go in with that attitude. So I try to get them into the mindset of a fresh start. Also, we have to help them people create, and we have to create sustainable success. So that's a big word. It has to be sustainable. That makes a big difference. Visualization makes a big difference too. Try to visualize, where do you want to be? What is your purpose? And very, very important, what are your core values? Assess your core values and look at any barriers in your life. Don't just go to saying, oh, it's going to be a new year and I'm going to uh, uh, present a new me and I'm going to look differently and I'm going to think differently and whatever. That's all good. It's all very positive, and everyone who knows me will say, I'm very positive. However, positivity without a plan isn't going to work. It might work, but the odds of it working are not great. You have to have a plan, and you have to have hope, and you also have to believe in change. In the word change, change is very, very, very difficult. People don't like change, and we'll talk about that in a minute. You have to look at the big picture. How are you going to do what you want to do financially? How are you going to do what you want to do emotionally? How are you going to do what you want to do physically? Maybe you're not well. I share a story after the holidays of a young man, maybe, I don't know, 24, who had a serious problem as a side effect of his diabetes. He had a gangrenous leg. And the only way to save his life, really, was the doctor recommended a amputation, and above the knee amputation. And the point was, he wasn't going to have it, and he didn't care. And he told me if he's going to die, he's going to die. He doesn't care. Anyway, he really did care. He cared very, very much. And we worked that through, and he had the surgery. And now he's up to he's healing. And then his next step will be to work on some kind of orthotic, which I can help him with. And as a patient advocate, as a very difficult thing, he's 25 years old. He wants an orthotic. You can imagine how much he wants an orthotic, but he wants to live and he wants to be able to get around. So we're working on clothes, and we're working on how the family feels about that and how people view him, because there's a lot of tension people feel about how other people think about them. So that was one story I wanted to share. I have a million stories that I'm going to share a few, and we can talk about them. Another issue I want to bring up is what we call present bias. This means that we tend to care more about instant gratifications than long-term rewards. And that is so true. If one pursues goals that are fun and they deeply believe in them, they're less likely to quote unquote give up. They better understand understand that achievement takes time. They stay more open and minded, and they're more optimistic. So they want to stay away. You want to stay away from the whole issue of instant gratification. Pretty much, I would say, in life, things that are gratifying are not instant. Everything takes time, and it takes determination, et cetera, et cetera. So I'm going to stop at that point, because I could, and we'll talk about all these different issues. But I want to reiterate first to remember that time is hard. This is not an easy time. If I spoke with 5 people today, I think I did, they have different problems. One is very stressed over work post-holiday, thinks he's going to lose his job. Somebody else is undergoing chemotherapy. Somebody else has an issue with wanted for the new year to be a nurse, and is having a whole lot of trouble with the exam. And turns out the trouble with the exam isn't the exam. It's the fact that she's had a diabetic reaction every time she takes the exam. She's taken it twice. And the accommodations group, whoever's in charge of accommodations, has not made accommodations for her to stop the exam and take her insulin. They asked her a million questions. I don't understand this pump and this and that. So she can't pass her exam. I mean, I was like shocked that they don't make accommodation for diabetes and taking your insulin, et cetera, et cetera. But, maybe Harley's taught me a lot. Harley has taught me a lot. And he has also taught me, don't be so shocked. That's one of his mantras. What are you so shocked about? And this is not particularly shocking, meaning these things happen. And that's what we're trying to accomplish. That's why we're advocates. So let's not be shocked. Let's be realistic. And let's have good beliefs, and let's have a plan. And I'm going to stop at this point now because it's a tremendous opening for good discussion.
Okay, so everybody is welcome to unmute themselves, and we have time for questions. And I'm sure Susan will have very brilliant answers to all of the possible questions.
And the ones I don't have the brilliant answers to, I will refer to Harley or another person in the room.
Okay, so I'm going to take the liberty of asking, I read somewhere that over the happier people are those who outsource a lot of the tasks they would rather not do. So if they have the resources to hire somebody, whether it's shoveling snow, cutting bushes, washing the kitchen floor, fixing the sink, watching, a kid every now and again, whatever it is, buying services for things that you really don't like doing seems to create more happiness than struggling to do it yourself. You want to comment on that?
For me comment?
Yeah,
absolutely. So that's what I'm talking about with the people that try not to need instant gratification for something and know the smartest people. This is I totally agree with that, Harley. I always feel the smartest people are the ones that tell you they don't know this and they don't know that and they need help here and they need help there. Why are they so smart? Because only someone who's not so smart thinks they can do everything. And no one can do everything. Plus, not to mention, or I will mention, I guess, is that it takes time away from what they do. So if someone is a physician and their patients need them, why are they taking their time, for example, shoveling snow when somebody else could come in and shovel the snow and they can save some lives or try to and do their, it doesn't make common sense to me. So I agree with you. I absolutely agree with you. The people that can delegate, I call it people that can delegate well are happier people because they know their limitations. Absolutely true. What do the rest of you think about that issue?
I think, Susan, the problem comes in when they don't realize that they have limitations.
Yeah, amen. True.
That is the issue. And
agree.
you have to go through that part to let them realize that they do have limitations, in spite of the fact that they claim they don't.
Right. So, Dr. Aurora, in your work, when we work together, on a regular basis, that was such an issue, right? Many people did not realize that. And they would say, they'd come into me and they'd say, Dr. Aurora says this would be good. And that was, but I'm doing okay. I'm really doing okay. So I had a stroke or I had whatever, but I'm talking pretty well. And I would say, you would say, maybe a speech therapist could help you. Maybe you should see, whatever it might be. And the people would think, I don't need help, or I don't need help, like Harley was saying, like doing a task when they can't walk. They can add so many things to contribute to the world, but they're in a wheelchair, let's say, and they can't get down and do this task. So why not have someone come in? I totally agree with you. People do not really understand that. They feel less, you think? They feel lesser than when they have to ask for help.
Yeah, it's an extension of that thought process that they're asking for help. So one has to wean them away from that fact that admitting to lack of ability to do something is not a sign of weakness.
No.
It's a sign of strength in saying that I can't do this at this time in my period. Maybe I could have done it, or maybe I can do it in future
Yeah, exactly.
after the crisis has passed,
Exactly.
and do the right thing to help themselves.
Exactly.
Yeah.
Right. And that's why we believe in a team working together.
Yes,
Right.
sometimes I found out things which I had no clue about because others told me, the nurses told me.
Right. Because you listened, however. So that's the very good point. So if someone isn't ready to listen, how are they going to learn these things?
I'd like to say the most dangerous doctor I ever worked with was a Harvard-educated doctor who knew it all.
Oh,
And
yeah.
he
Oh, yeah.
scared the hell out of me.
Yeah. So how did you think would the best way to handle someone like that was? Was it not possible to really do that?
Well, I tried to educate him, and then I finally told him not to refer any patients to me anymore.
That
You know,
was
Thank you very much.
sometimes you have to take certain action, as Susan was talking about the fact that just talking about things is not necessarily everything. You have to sometimes sit back and say, well, I can't take this anymore, and
Yeah,
I'm going to take some action.
Right.
And the action you took, Ray, was,
agree.
I don't want to see your patients.
Yeah.
I don't want to deal with it
Can't work with you.
Yeah.
Yeah.
because it's not good for my mental health.
Right.
Mm.
Exactly.
Yeah. So sometimes you have to protect yourself.
Yes.
So what I was going to ask
Yeah,
Susan is, so
great.
how do you reach somebody, because there are people who feel they have to be super mom or Superman or whatever, or Wonder Woman, that they should be able to do these things, whatever they are, but they can't, but they feel like they should.
Lost you, Harley.
you're frozen.
Frozen.
Just for the second. Yeah.
Yeah. Oh, it's now
I
okay.
get
Yeah. Okay, so how do you get somebody to move toward admitting that they actually do need help?
Well, so usually I find it's a self-esteem issue. A person, so I try to help them feel better about what they do. So I focus on what it is that they do and try to find out what is their biggest skill. Okay, everybody can't be skilled at everything. So if the biggest skill is cooking, let's say making meals, then they shouldn't maybe be driving carpool or running around and doing all the other kinds of things. They should focus, I help them, I empower them to focus on what do they really want to accomplish and what is your greatest skill. And sometimes people won't cooperate, as you know, no matter what one says. And that's where, Ray, I believe, was right, that you can't deal with them. You just can't help them, but you try to help them center in. And a lot of times I use cognitive behavioral therapy for that. I show them why their plan won't work. When I spin it, when they give me, I say, okay, so you do da 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 da, and here are your thoughts and here are your emotions, and you spin that, and you're in the hospital because you're having a breakdown. I see someone like that right now. It's too much. It's too much. You're tackling more than one person can do. And but sometimes I have to show them that, Harley, on paper. They have to have a visual. I don't do a lot of talking. Then I get out my pad and I show them how we could capitalize that they're doing great. I don't ever put them down. I tell them they're doing great, but they're doing great in too many areas. And they're one person. As far as I can tell, they're one person. And so we have to delineate what they're going to do. I hope that helps with the answer. I do a lot of writing. I pull out my pad and I show them how that's not going to work. And then I give them time to figure it out, and in a very quiet, supportive way.
Yeah.
Sometimes I do.
Sometimes you have to fail. I mean, you have to say, okay, try it. It may not
yeah.
work. So then it may fail. If it fails and doesn't work, then what?
Then I tell them, you haven't failed. You, Josephine, whoever, you haven't failed. Your idea of what you can do is not realistic. It's
Mhm.
not planted in reality. So we have to kind of figure, you're doing great. I build them way up and I say, you're doing great, but we have to kind of zero in on what do you really want to do? And let's try to think about it. I do that a lot when people are a good example. I do that a lot when people are sick and they say, well, yeah, I had, I went through this treatment or that treatment, but I can go and I'm going to go shopping and I'm going to buy some presents for the kids' birthday. They have to go to birthday parties and this and that. And I tell them that they need to tell their friends that when they ask what they can do to help, don't bring me another lasagna because I have 20,000 of them already. But what you could do is you could go to the store and you could buy like 5 presents that would be suitable for a 12-year-old birthday party. And then the mother puts it in the closet and she's a real heroine. And every time it's a birthday party, she opens the closet and on the bottom, she sees what the present is and and everybody says, wow, you're going through so much and you never forget anyone's birthday. That's amazing. So I try to help them see what can, sort of navigate.
That's pretty clever. Okay, great. Any other comments, questions? Wow, everybody is dazzled. Okay, very good. Yeah, there are things that you can do, you might be able to do. I mean, I had a very simple thing this week. I mean, I had a tail light out and I know that I could go to the auto parts store and try to get the right bulb and then take the thing apart. And it would take me basically 4 hours because I've done this before on that assembly. And I figured out that it's quicker to go down the street to the local guys and say, can you just do this? They have the bulb, they have the tools. It took them 10 minutes. And I just paid them, it's not even worth the hassle. Yes, you could do it. You can do it yourself, but there's really no reason to, when you can get help from somebody who knows what they're doing. So that also means that, they don't call attorneys, advocates for nothing. It's very comforting sometimes knowing that you have somebody on your side who essentially buffers you from whatever it is. So, even if, you could try to represent yourself or whatever it is, or deal with a situation or an insurance company or whatever it is, better to let people who've done this 100 times, 200 times. Yeah, you can learn new skills, but maybe there are other things that you should want to invest in, whether it's, being with the kids, dealing and talking to old friends, doing something that you really enjoy so that you do feel like there's a weight off your shoulders and elated.
Absolutely.
Yeah, I think this becomes, well, I guess it's one thing when one is constrained about time. When one is not constrained about time, it is not, even at the cost of time, when you're not constrained in time, to learn a new skill. And that gives you a lot of pleasure and a lot of satisfaction also. So there are different ways of, depending on the given situation. That's where probably Susan comes in when she's advising people that if somebody has the time and the energy to do something, even though it is new, it can be done as long as a person senses that they are motivated to do that for the right reason. And it may take them 4 hours instead of 10 minutes or 15 minutes, but the mere joy of doing it is worth that particular time. So every situation is different or can be different. And And one can then become an advocate in a different way. One can become an advocate in saying, well, do you really enjoy this? Do you want to do this? And yes, go ahead and do it if you have time to do it.
Right.
Okay.
That's
So
very
it
true.
has to be sort of
I
couched
think-
in the circumstances where the person is.
Yeah.
And I mean, I'm saying that primarily because I'm retired. And so I have certain time of doing things which I never would have imagined I would enjoy or
Mhm.
do.
That's
And
great.
then, you know, and it's a pleasure to do some of those things. By the same token, the right thing is that if you are doing it under duress or under pressure, don't do it.
Exactly.
Then get somebody else to do it.
If you don't have to be.
I've learned to be humble in many circumstances. I'm retired as well, but I've volunteered around the world doing, I'm a surgeon, and I've learned things from the residents in Nepal. I've learned things from the students I was teaching in Ethiopia. I've learned things at night on YouTube that I had to do the next day.
Wow.
Yes.
Mhm.
Yes.
Being humble and learning from your surroundings, no matter what they are, is very gratifying.
Yes.
I was in Ethiopia doing a lot of surgery for several months, and they asked me to go do a circumcision. And I said, I don't want to hurt a little baby. I haven't done a circumcision in 35 years. Please help me do it. And they laughed and laughed because I was doing big surgeries, but they
Oh,
taught me how to do a circumcision, and they felt good. I felt good.
Right.
I've had lots of experiences that way.
Yeah.
that's a great story. That's a great
It
story.
is.
Susan, I was going to ask you, you know, it's New Year's and everybody goes, oh, I'm going to make my 8,000 New Year's resolutions and I'm going to do them all. And then, you know, I'm going to go to the gym every day and I'm going to lose 40 pounds and I'm going to lift, you know, 400 pounds over my head with two pinkies. And I'm going to do this and I'm going to do that. And this goes on for maybe 2 weeks. And then what happens? So then there's a letdown because people make these unrealistic resolutions of what they're going to do and how they're going to do it. So how do you advise them at that point?
Well, we talk about they tried to do something and maybe their expectation wasn't something that they could quite do. It fit in their schedule or wasn't something they could quite do. Maybe they could do it modified. So that's great that you went to the gym, you know, so you went every day. So do you think you could go to the gym 3 days a week? Do you think you could take a walk so many times? You know, somebody says, I can't walk too far, I get winded. You don't have to walk far. Start out slowly. And then, but the idea is to honor everything you do as opposed to making some grandiose plan and then being saddened and upset with yourself for not being able to achieve it. So I break it down. That's what I mean about steps, Harley. Then when I say that, take it in steps, I try to break it down and I say, you know, you can forgive yourself. That's okay. You didn't do anything wrong. But I think maybe with your schedule, let's look at your schedule. And I get their whole schedule out. I make them do a journal and give me their schedule. And they say they don't have time for this. And then we try to work out, what do you want to do? And all of a sudden, like magic, they have time. They have, wow, I didn't think I had any time. They spend some of the time, you know, doing something that's not productive. And it's not sustainable. It's really not, you know, they mean well, but I make sure they know it's not a matter of quote unquote failing. Not one of my favorite words. There's no such, you know, I don't like the word fail. I don't like the word perfect. Nothing's perfect. Everything's imperfect. Do the best you can, but lay it out. Let's look at it. Let's take a look and see what you can do. And then they say, oh yeah, I can go to the gym 3 times a week. I said, that's terrific. You take a nice walk and, you know, whatever it might be.
Okay, great.
Eating properly, right? I can do that. They can do that some of the time. They can't do it all the time. That's fine. They don't have to do it all the time.
Okay.
Just do it when you can do it. Realistically, realistic.
Okay. Anything else people want to contribute?
Yeah, I'd like to say something. You know, when I was when you go through medical school, you know, you think you're the head of the team, and then when I started working in chemical dependency, they put me in my place, and they said, no, this is a team. That's the way people get sober, you know. And I think that carries all the way through life. I mean, here I'm 76 years old now, and I realize that, you know, and for years I realized that you gain more by seeing what your peers are doing, and even your peers in medicine, your peers in what you were talking about, the peer mechanics who know how to do things, and you reach out to other people, and a lot of times our own ego gets in the way, and
Yeah.
you have to lower your ego. I think as you get older, you know, you just sort of dropping your ego. One of my daughters, who's very accomplished, but she's got 3 kids and she's a doctor and she's busy all the time. She says, I'm a B- now. I don't need to be an A anymore. I can't be anymore. And I think that you have to have realistic expectations and realistic behavior. And I think that you also learn that from people who are being successful in their own life. And like one of the other doctors said, you just keep learning all the time.
That's
And
great.
the more you learn, the more comfortable you get with yourself, which is kind of an interesting way of looking at it.
I think that's a great, do you go by Bob? I think you
Yeah.
go by Bob.
Yeah.
Okay. Robert, you go by Robert?
Well, ask Harley. I don't know what I go by.
Okay, I'll ask Carly. But that's very true. I totally agree with what you're saying. And it humbles us, right?
Yeah,
And also as you know, Dr. Aurora was saying earlier too, and Ray, everybody was saying, the point is that we do certain things, and certain things maybe we can't quite do them, you know, and you know, it's like maybe we don't have to be the best at everything, and we have to have a schedule that's workable. We have to know our limitations. That's one word I like. Do you like that? To
you know,
kind of
the other thing that's interesting is that you know, I always say a smart man is always one who marries a smarter woman. And so you realize that you need to learn to listen to your wife, you know, and you need to listen to your kids because they grow up, they've learned your behavior, and sometimes they know more about things than you do, and you have to listen to other people, and that's what we all have to work on.
That's true. That's so smart.
Yeah.
Thank you.
Yeah, I think as we grow older, we sort of realize that the middle path is a better path.
Uh,
That's good.
Great. Okay, well, anybody else